Hi there. Welcome to the Healthcare Analytics Summit. My name is Greg Berman. I'm an anesthesiologist and the Vice President of Acceleration and Enablement in Kaiser Permanente, Colorado. Very excited to be with you all today to share our journey of incorporating deep care delivery automation into our perioperative space. We had some challenges within our business where we've created a really high quality, high value perioperative clinic to get patients mentally and physically ready for surgery. We had an excellent product. We had excellent protocols, but it was very difficult to scale to match the needs of our 600,000 patients here in Kaiser Permanente, Colorado. We also knew that from patient feedback, they didn't love the way that we communicated with them during this process, having to come in for in-person visits, paperwork that was handed out, and phone calls as our main means of managing their care. This clinic we call the Preoperative Evaluation and Education Center was really caring for about 60 to 70% of our preoperative patients. And we knew that the quality outcomes that they had were such that we needed to find a way to increase the percentage of our patients that received that care. We came up with a business case that essentially said if we could automate the history or the questionnaire to understand all of the risk factors we need to understand how to prepare our patients for surgery, we'd be able to scale our processes, meet our patient needs, and drive joy and work for our clinical teams. The goal was to use automation to drive that membership to go through our peak clinic, increasing from 70% to 95%. We felt that by doing this automation and creating care journeys that were orchestrated, we could increase our nurse practitioner efficiency in this clinic to manage that with even less FTE. It was very important to us that the quality of the care that we were delivering was maintained throughout this process. So we've been monitoring surgery cancellation rates, as well as understanding the member experience of this platform. We also wanted to make sure we were targeting the reduction of human errors by creating consistent algorithms. So our solution was really to re-engineer the digital preoperative workflow. We put our clinical anesthesiologists in a room and said, let's take a look at the most up-to-date evidence-based guidelines. And what we did was we created two separate pathways. We create a pathway for a patient based on who they are. So a 67-year-old male with hypertension, diabetes, and obesity, a pathway is developed based on who the patient is. Then we add the second pathway, which is what surgery that patient's having. So if they're having a total knee replacement, that layers on a second pathway that creates a truly personalized pathway for patients to pass through to be successfully ready for surgery. We were able to do this using virtual modalities, avoiding face-to-face visits, using drip communication styles to constantly stay in touch with our patients and keep them on track. This became key to how we would solve this problem by enabling us to match the level of care to the patient's need. So for example, if a patient has a complex medical history, their pathway is more complex, which may require our nurse practitioners to step in and get involved to help them. But if the patient is able to meet all of those steps in the pathway successfully with normal labs, normal questions being answered, normal imaging and EKG results, we can fast track our patients all the way through the system rapidly. We use digital communications to understand when to communicate with patients when they needed to fast before surgery, what meds to stop taking, and why, as well as the very important logistics and mental preparation for surgery. We were able to leverage this solution to really drive care team coordination, using our nurse practitioners instead of history and physical takers, but really as pre-surgical liaisons, helping to guide patients through their surgical journey, oftentimes not having to lift the phone or bring patients in at all. The solution looks something like this. As soon as the surgery is scheduled, we send a pre-anesthesia assessment questionnaire, which takes into account the automated risk scoring to enable us to quickly triage our patients and stratify them into different groups. There will be a brief chart review by our nurse practitioner teams in our preoperative clinic, and then it becomes into monitoring phase. That pre-op chart review drives most of our patients through the fast track, which again requires very minimal interruption and interaction from our care team. But from the patient perspective, we're constantly outreaching and touching them by asking them questions and having them fill out information to help complete the history portion of their history and physical before surgery. Based on who the patient is and the surgery they're having, labs, imaging, cardiac testing is all automatically ordered. And then the patient becomes cleared for surgery, gets automated patient instructions with clear communication and ability to interact with our system to get the answers they need to be mentally and physically ready for surgery. By understanding what results are already available within the appropriate timeline of our electronic medical record, we're able to minimize unnecessary testing and really only order the tests that are going to be value add to our clinical assessment before surgery. Well, here are our results. We went live with our program in June of 2021 and have already had over 1,000 patients entered into our program. We've been able to see a lot of the results that we hoped for from the early days of turning this system on. Over 94% of our patients are adopting and opting into this program, with 94% of our patients completing the questionnaire. From this initial triage, we're able to do an incredible amount of focused attention on the 32%, 33% that require anything beyond a case review. Again, leveraging our valuable clinical resources to focus their attention where the need is. And that need is not only older, more sick patients. If a young, healthy patient is having an orthopedic surgery from a mountain biking accident here in Colorado and happens to get into a car accident a week before surgery, we're able to pick up on that, discuss what's going on with the patient, and direct them and coordinate their care appropriately. What we know is that by having this system in place, we're able to fast track 67% of our patients from that initial triage right through our system. And from that, 63% of our total patients are able to go from start to finish all the way through with no further interaction of our care delivery team other than that initial 5 to 10 minute chart review. You compare that to the before state where every patient was coming into our clinic for a 30-minute face-to-face visit, and you can see the efficiency that we were able to achieve with our care team, driving more and more patients into our clinic virtually, but giving that quality outcome that we've come to expect from our face-to-face. Again, the efficiency that we're seeing within our care teams is striking and growing every day. A little bit more data that we want to share, but interestingly, 79% of our patients are completing their questionnaire within 4 days of sending it. We're starting this process up to 30 days out of surgery, but oftentimes the question that we have is, well, what if I need to book a surgery within 7 days? Does that mean we can't use this virtual platform? Well, no, what we're finding is that over 80% of our patients are completing that questionnaire within 4 days. And if our care teams are aware of the surgical date with this program enables, we can nudge our patients if they're not meeting that timeline. This means that over 60% of our patients are cleared for surgery within 4 days of sending a questionnaire, an incredible throughput advancement for our care delivery system. Most of the labs that are ordered are now automated. As you can see, only the dark blue labs are added by humans, and this is constantly being evaluated and adapted within our algorithm to constantly decrease the amount of additional tasks that humans have to capture here to get our patients ready for surgery. It was really important to us that we were fundamentally changing some people's jobs, and then as an anesthesiologist, we were changing the output of what they were receiving. And what we found is from the joy and work perspective, our care teams are really enjoying this new approach. They feel like they are better guides and sort of navigators for our patients. And from an anesthesia perspective, the output is just as good, if not better, than what we've had before. So I would say the key learnings for us is that we believe that automation can be an enabler for better care delivery. It allowed, in this example, for us to be able to scale more rapidly, which is going to lead to improved access to care. By implementing this solution, we're opening up hundreds of primary care visits every month. By having an algorithm-based decision unit, we're able to improve the consistency of the decisions that are being made and constantly adapt to new evidence coming out in the literature. we're thinking differently about how we utilize our staff. Again, matching the care to the patient's need is so critical when you think about caring for a population as we do in Kaiser Permanente. What we're also able to do is really focus on top of scope work. Routine tasks like data entry and normal lab review are reduced, if not eliminated at all. And then finally, we know this algorithm has to be adaptable. The medicine of perioperative care is changing rapidly. And this algorithm that we have in place can adapt to new evidence-based learnings that we would want to incorporate into our templates.